Hi, my name is Andrea Orta Mashburn, and today I'm going to discuss when to feed your baby finger foods. Before feeding your child finger foods, one of the first things that you need to remember again is that you need to discuss it with your pediatrician. Make sure that you've also introduced, before feeding them finger foods, rice cereal, oatmeal, fruits and vegetables, and that your child can successfully eat them on his own. It may also be good for you to know that if your child has begun expressing interest in the foods that you're eating, that they're typically ready to eat finger foods as well. Make sure also that they have the mechanical skills that they can pick up these foods on their own. Make sure as well that they have the mechanical abilities to pick up foods on their own. If a child can pick up individual pieces of food on their own, they're typically ready for finger food. When you go to the grocery store, you can see that they have a couple of different finger food options for your child. One of the first finger foods that you can actually introduce for your child are some of the dissolving finger foods. These are the finger foods that they can typically place on their tongue and it dissolves in their mouth. This first works on their mechanical abilities to pick up the food on their own. After your child has successfully begun eating these dissolving finger foods, you can then move on to additional finger foods as well. If you're doing finger foods that are a little bit harder for them to be able to chew, make sure that they have teeth. Typically, some of the cookies that they have as finger foods are kind of hard for most of the infants. So you want to make sure that they have a little bit of the ability to chew. You can also check to see if some of the cookies that they introduce as finger foods, sometimes they're dissolvable as well. So make sure that you read up and do a little bit of research before introducing some of the finger foods to your child. So remember, be patient, be safe, and always put your baby's needs first.